Hey everyone, welcome back. We are going to be doing a deep dive into some autism research today.
Okay.
So you sent over this article by Jaime Hoerricks, PhD, called Stop Studying Autism and Do Something Already.
Yeah.
Have you had a chance to look at this at all?
Yeah, I have, and it's really interesting.
Yeah, what are your thoughts?
Well, so Horrocks is arguing that, and they're writing from their perspective as an autistic trans woman, they're arguing that decades of research have highlighted all the challenges that autistic people face,
Mm-hmm.
but there just has not been enough action to improve the lives of autistic people.
It's kind of like we just keep hearing about the problems but not seeing solutions.
Right. Exactly.
And that's incredibly frustrating. And I think that's kind of what Hoerricks is getting at in this article.
Yeah, definitely.
And one of the things that really stood out to me was the study that they talk about from the Autism Research Centre.
Right. So the ARC, the Autism Research Centre at Cambridge, just came out with a new paper published in Molecular Autism. And this new paper points out that there are these serious healthcare disparities and poorer health outcomes that autistic people are facing.
Wow.
And especially autistic people who are also transgender and gender diverse.
And that's something that Hoerricks is particularly frustrated about because it's not new information.
Right. It's like, haven't autistic people been saying this for years?
Exactly. Like,
Right.
what's the point of all this research if it's not going to lead to any change?
Yeah, that's the real question here, isn't it?
Yeah, and they even go so far as to say that maybe we should just shut down the ARC
Yeah.
if all it's going to do is just document the suffering
Right.
and not actually push for solutions, which I thought was an interesting point.
It is. It makes you think.
Yeah, it does. And you also sent over some research by Simon Baron-Cohen.
Yeah.
And it seems like Hoerricks takes issue with some of his theories.
Well, Baron-Cohen is the one who heads the ARC, and he's been a pretty controversial figure in autism research.
Okay.
For example, he has this theory called the extreme male brain theory of autism, which has received a lot of pushback, particularly from autistic women and gender diverse folks, because, well, the theory kind of relies on these very fixed and traditional ideas about gender.
So they would argue that it could be harmful in some ways.
Potentially, yeah.
Okay, interesting. And then there's also all this research about like prenatal hormone exposure.
Right.
And they're trying to find a biological cause for autism. But like we were saying earlier, is that really helpful for autistic people right now?
Right. I mean, it's not necessarily going to change anything about their day-to-day lives, is it?
Right.
And that's where this whole disconnect between research and reality comes into play. Hoerricks is really pushing for us to move away from these abstract theories
Yeah.
and to focus on research that's really addressing the needs of autistic people right now.
So less about why it exists and more about how we can make life better for people who are autistic.
Exactly.
Now, when you say addressing the needs, like what kind of things are we talking about?
Well, think about it this way. You mentioned earlier that you were interested in learning about how to make spaces more sensory friendly.
Oh, yeah.
So that's a perfect example of the kind of research that Hoerricks is advocating for.
Wait, so you're telling me there's research out there that could help me understand sensory issues better?
Yeah, absolutely. And not just understand them, but actually design spaces that are more comfortable for people with sensory sensitivities.
Oh, wow.
You know? So imagine a world where you walk into a hospital
Yeah.
or a school or even a workplace,
Mm-hmm.
and it's actually designed with sensory needs in mind.
That would be incredible.
Yeah. And that's the kind of tangible impact that Hoerricks is talking about.
I actually feel a little bit more hopeful after hearing that.
That's good because we don't want to get too bogged down in all the negativity.
Right.
There are issues,
Mm-hmm.
but there's also hope.
Okay, so we've talked about the problems. So what about the solutions? What does Hoerricks want us to do?
Well, one of the biggest things is shifting funding priorities.
Mm.
So instead of pouring all this money into research that basically just confirms what autistic people already know,
Right.
let's redirect those funds towards research that's actually going to lead to practical solutions.
So what are some examples of practical solutions?
Well, we were just talking about those healthcare disparities
Right.
highlighted in that ARC study.
Mm-hmm.
So imagine if research focused on developing like autism-specific healthcare models or training healthcare professionals to better understand and support autistic patients,
Mm-hmm.
or creating crisis intervention services that are tailored to autistic needs.
That makes a lot of sense.
Yeah.
So it's about going beyond just like the understanding of autism and like actually using that knowledge to create change.
Exactly.
Yeah.
And another key point is that autistic people need to be involved in the research process.
Okay.
So instead of just studying autistic people,
Mm-hmm.
we need to be partnering with them.
So autistic-led research.
Exactly.
Okay, I like that.
And it's not just about being participants in studies, but actually being the ones who are asking the questions,
Mm-hmm.
designing the studies, and shaping the entire research agenda.
That's pretty powerful.
Yeah, it is.
But how realistic is that? Like, do you think that can actually happen?
It's a challenge, for sure.
Yeah.
But it's starting to happen.
Really?
Yeah, there are researchers and institutions that are starting to embrace this more collaborative approach.
That's really encouraging.
Yeah, and remember, change takes time.
Yeah, of course.
But the important thing is that we're having these conversations.
Mm-hmm.
More and more people are recognizing that this is important.
So, okay, we've talked about shifting funding priorities.
Yeah.
We've talked about making research more inclusive. What else does Hoerricks say needs to change?
Accountability.
Accountability.
Yeah, it's not enough to just do the research and publish the papers.
Right.
Researchers need to be held accountable for making sure that their findings lead to actual improvements in the lives of autistic people.
Okay, how do we do that? How do we hold researchers accountable?
That's a great question. And that's actually something that we're going to be exploring in more detail in the next part of our deep dive.
Okay.
We're going to be looking at some examples of research that's actually making a difference
Cool.
and talking about what you, as an individual, can do to advocate for change.
But before we move on,
Yeah.
I do want to touch on something that Hoerricks said that I thought was really important.
Okay.
They said that this isn't just about like, we need to make some changes. They said it's a life or death situation
Yeah.
for many autistic people.
You're absolutely right.
Like we've been talking about these health disparities,
Mm-hmm.
the higher rates of mental health challenges, but the statistic that is just so alarming is the significantly higher rate of suicide among autistic individuals, especially for autistic youth and women.
Yeah.
So this isn't just an academic debate. We're
Yeah.
talking about real lives at stake.
Exactly. It's very serious.
And it makes Hoerricks' call to action even more urgent.
It does.
We can't just wait around.
Yeah.
We need change now.
Yeah. And that's why it's so important to have these conversations, to raise awareness and to push for research that actually serves the needs of the autistic community.
Absolutely. All right. Well, let's take a quick break, and then when we come back, we'll be talking more about those solutions.
Sounds good. It's easy to get overwhelmed by all those numbers, all those statistics, but, even small changes can make a difference.
Okay, so where do we even start? You mentioned accountability for researchers earlier. Like,
Yeah.
how do we actually do that?
Well, imagine instead of researchers just publishing their findings in academic journals,
Mm-hmm.
what if they were actually required to present their work directly to autistic communities?
Okay.
And explain, in plain language, how their research could lead to like better services or support, or even just like more understanding.
I like that it forces them to actually think about what it means in the real world.
Right. Exactly.
But are there actual examples of like research that's making a difference right now?
Oh, yeah, absolutely.
Okay.
One area where we're seeing real progress is in developing sensory-friendly spaces.
Okay.
Remember we were talking about how hospitals can be so overwhelming?
Yeah, like that was a huge realization for me. I never really thought about, like the bright lights and loud noises
Right.
and how that can make it so difficult for someone to even like access healthcare.
Exactly. And now researchers are working directly with autistic people
Oh, wow.
to design spaces that are like calming and predictable and just more accommodating to different sensory needs.
That's amazing.
Yeah, so like some hospitals are even creating like designated quiet rooms
Oh, wow.
or offering sensory kits to help people manage their sensory input.
So it's really about, not just doing the theoretical research, but like actually putting it into practice.
Right, and making those tangible
I
changes.
love that.
Yeah.
The sensory-friendly design. What else? What other kinds of research are we seeing that's making a difference?
Another big area is mental health services.
Okay.
So for a long time, mental health interventions weren't really designed with autistic people in mind.
Mm-hmm.
But now there's this movement to develop like autism-specific therapies and support programs.
Which is so important because they experience the world in a different way.
Exactly. So they need different kinds of support.
Yeah.
And, these specialized interventions are showing some really promising results.
Oh, good.
Yeah, they're helping autistic people manage like anxiety and depression and other challenges in a way that's just more effective and empowering.
Awesome. Okay, so we've got sensory-friendly design.
Uh-huh.
You've got specialized mental health support.
Yeah.
What else? What's on the horizon?
So one thing I'm really excited about is assistive technology
Okay.
that's designed specifically for autistic people.
Like what?
Well, so there are researchers who are working on like apps
Hmm.
that can help with communication or social interaction or even emotional regulation.
It's like using technology to bridge the gap.
Yeah, exactly.
That's cool.
And the nice thing about assistive technology is that it can be really tailored to individual needs.
Oh, yeah, because not everyone needs the same kind of support.
Right, exactly.
Okay. This is all starting to sound a lot more hopeful. It sounds like we're actually moving in the right direction.
I think so, there's this growing recognition that the old ways of doing things just aren't working.
Mm-hmm.
We need to listen to autistic people,
Yeah.
involve them in the research process, and really prioritize research that's going to lead to those tangible improvements in their lives.
And it sounds like you're saying that these changes aren't just something that might happen in the future. There are
Yeah.
things happening right now that are
Literally.
making a difference.
Absolutely. And it's not just researchers who are driving this change.
Oh, okay.
Autistic self-advocates are playing a huge role.
Yeah, because when they speak up, people have to listen.
Exactly. And that's where, you as an individual can make a difference too.
Okay, but I'm just one person. Like, what can I actually do? Yeah.
Even small actions can have a big impact.
Okay, like what?
Well, you can start by educating yourself
Mm-hmm.
about autism and the issues that autistic people face.
Okay.
You can support organizations and initiatives that are led by autistic people.
Mm-hmm.
You can share information with your friends and family.
So raising awareness, spreading the word.
Exactly. And if you're really passionate about a particular issue, you can contact your elected officials.
Yeah.
Advocate for policies that support autistic people.
So use our voices to make sure that their perspectives are represented.
Exactly. And you don't have to be an expert on policy to do that.
Yeah.
Just speak from the heart.
Yeah.
Share what you've learned and let them know why this issue matters to you.
Okay, so that's supporting organizations, that's advocating for policies. What else?
Well, there's another really important way to make a difference,
Okay.
and that's through volunteering.
Volunteering. Okay.
Yeah, there are so many organizations out there
Mm-hmm.
that are working directly with autistic people, and they always need volunteers.
So I could like volunteer my time to like help out.
Exactly. And, you can find organizations that are focused on all sorts of things,
Okay.
like providing social and recreational opportunities or offering job training and employment support,
Oh, wow.
or even just providing like companionship and emotional support.
So many different ways to get involved.
Yeah, there really are. And, volunteering is not only a great way to give back,
Mm-hmm.
but it's also an amazing opportunity to learn,
Okay.
to connect with people, and to really make a tangible difference in someone's life.
That's awesome. I love that.
Yeah,
All right, well, we've covered a lot of ground today.
we have.
And I have to admit, it's a lot to process.
I know it's a lot, but it's important.
It is.
And, even if you just take away one thing from our conversation today,
Yeah.
that's a step in the right direction.
Okay, so for all of our listeners out there who are feeling a little bit overwhelmed right now,
Yeah.
what's like the one thing you want them to remember?
That they have the power to make a difference.
That's a great message.
And that even small actions can have a ripple effect.
Yeah.
Whether it's educating yourself or supporting an organization or simply talking to your friends and family, every little bit counts.
This has been such a powerful deep dive, and I feel like we've gone from feeling totally overwhelmed to actually feeling empowered to do something.
I'm glad to hear that.
And I think the biggest takeaway for me is that research isn't just about abstract theories and academic publications.
Right.
It's about real people's lives.
Exactly.
And it's about creating a world where autistic people aren't just studied, but truly supported and valued and empowered to live their best lives.
I couldn't have said it better myself.
And this isn't just about doing something for autistic people. It's about creating a more inclusive world for everyone.
Absolutely.
When we design spaces that are sensory friendly,
Uh-huh.
develop mental health services that are accessible, and promote technologies that empower people with different needs, we all benefit.
It's like that ripple effect we were talking about.
Exactly. Small changes can have a huge impact.
Yeah.
Not just for autistic people, but for society as a whole.
I agree.
So as we wrap up today, let's remember that we all have a role to play in creating a world where everyone can thrive.
That's right.
Keep learning.
Keep asking questions.
Keep pushing for change.
Exactly.
Thank you so much for joining us on this deep dive today.
It was my pleasure.
We hope you found it insightful and inspiring, and remember, the conversation doesn't end here.
Right. Keep talking about it.
Keep connecting with each other and keep working together to create a better world for all. Okay, so we've talked about a lot of really heavy stuff, and even though we're ending on a more hopeful note, I'm feeling a little overwhelmed.
I think that's totally understandable.
Yeah.
It's a lot to take in.
Yeah, so where do we even begin?
Well, I think it's important to remember that you don't have to become an expert on autism overnight.
Mm-hmm.
Just start by focusing on what resonated with you the most from our conversation today. Like what really stood out to you? What are you most interested in?
Well, I think the whole sensory-friendly design thing was really fascinating to me.
Yeah.
And the idea of using technology to help people with communication and social interaction.
Mm-hmm. Those are all great places to start.
Yeah.
And once you've kind of identified an area that you're passionate about,
Yeah.
there are tons of resources out there.
Like what?
Well, there's so many amazing organizations doing incredible work, and they're led by autistic people.
Oh, wow.
So you can volunteer your time, you can donate to their cause, or even just spread the word about their work.
Are there any organizations you recommend checking out?
Yeah, absolutely. The
Yeah.
Autistic Self-Advocacy Network, or ASN,
Okay.
they're a national organization, and they do really incredible work advocating for policy change
Okay.
and promoting self-determination for autistic individuals.
I really like that idea of people being able to advocate for themselves
Yeah, absolutely.
and have control over their own lives.
Exactly. And there are a ton of other organizations out there, too,
Okay.
doing amazing work at the local and regional level.
So how would I find those?
Honestly, just a quick Google search.
Oh, okay.
Autism organizations near me, something like that.
Easy enough.
Yeah.
Okay, so we've talked about organizations. What about the policy side of things?
Yeah.
You mentioned contacting elected officials, but what kind of impact can I, as one person, really have?
You'd be surprised.
Really?
Yeah. Elected officials rely on feedback from their constituents.
Oh,
So a simple email or a phone call or even just a tweet can make a difference.
so just letting them know that I care about this issue.
Exactly. And that you support policies that prioritize autistic people.
Got it.
And, you don't have to be like a policy expert.
Okay, good.
Just speak from your heart and share what you've learned
Okay.
and let them know why this is important to you.
This has honestly been such an eye-opening conversation. I feel like I've gone from feeling totally overwhelmed to actually feeling empowered.
I'm so glad to hear that.
Yeah.
I think that's what Hoerricks was hoping for.
Yeah.
Their article was a call to action,
Mm-hmm.
and it's up to all of us to answer that call.
So whether we're supporting these organizations or advocating for change,
Right.
or even just educating ourselves and talking to our friends and family, everything we do makes a difference.
I think so.
The biggest takeaway for me is that research isn't just about those abstract theories in academic publications.
Mhm.
It's about real people's lives.
It is.
And it's about creating a world where autistic people are not just studied, but truly supported,
Yeah.
valued, and empowered to live their best lives.
I love that.
And, this isn't just about doing something for autistic people.
Right.
This is about creating a more inclusive world for everyone.
Absolutely.
When we design spaces that are sensory friendly, when we develop mental health services that are accessible, when we promote technologies that empower people with different needs, we all benefit.
It's that ripple effect we were talking about.
Exactly.
Small changes, big impact.
Not just for autistic people, but for everyone.
Or everyone.
Okay, so as we wrap up this deep dive today, let's just all remember that we have a role to play
Yes, we do.
in creating a world where everyone can thrive.
A better world for all.
Keep learning, keep asking questions, and keep pushing for change.
Couldn't have said it better myself.
Thank you so much for joining us today.
It was my pleasure.
We hope you found this conversation as insightful and inspiring as we have.
Yeah, me too.
And remember, the conversation doesn't end here.
Keep talking about it.
Keep connecting with each other and keep working together to create the better world for all.